I guess the team is starting in a few minutes. Let us
My watch, we are past 11 already.
Yeah, so we started with some of the technical things, I believe. It's been 1 or 2 minutes. I will manage the start. Hello and welcome you all to yet another live session on Kidney Care Talk Show series. This is an initiative by IHW Council and is being powered by JB Chemicals and Pharmaceuticals. The purpose of this series is to raise awareness on the different aspects around kidney care, for which we have a very eminent speaker with us today, Dr. Bhanu Mishra. He is Associate Consultant Nephrologist with BLK Max Hospital, New Delhi. Sir, a very warm welcome to the show. Thank you for joining.
Thank you for inviting me to such a audit platform. Thank you.
And with that, let us start with our discussion for the day. So, the topic of discussion today is all about kidney donations and organ transplants. So, I request Dr. Bhanu to please give her introduction to kidney donations and transplants, a brief overview, so that all those who are not familiar with the process are made aware. Over to you.
Thank you, Dr. Asaveri. For a brief overview about transplant, so the first question comes to everybody's mind: who needs a kidney transplant? And these are the people who are in stage 5 of their kidney diseases, and people who are already on dialysis. They are the suitable candidates for renal transplant. Now, there are two types of major renal transplant. One is live related, in which the donor is a live related uh, person, and the other is cadaveric transplant, in which a brain dead person or a cardiac standstill transplant, in which the heart is stopped working. So, these are the two major types of cadaveric and live related transplants. So, these are the two major types. Then who is eligible for transplant? These are the next question that comes in. So about one is that you're in stage 5 and one you're in dialysis. Second is you should be free from other major diseases or illnesses. For example, if you have a cancer going on with you, for example, if you have a psychiatric disease along with you, or you are an addict for alcohol or smoking or tobacco or anything else, you become ineligible for transplant. So those are the other things. You should be fit for handling surgeries. For example, if you have a big cardiac issue or a big lung issue, you might become ineligible for transplant. Okay. Or if you have a disease, for example, somebody has a stone disease, which is primarily mediated by liver, for example, primary hyperoxaluria. So you cannot become a candidate for just kidney transplant. You will have to do liver plus kidney transplant. So there are more nitty-gritties to the details of transplant, but I think this would be the brief overview.
Thank you so much, sir, for giving us brief overview. So, as we know that kidney transplants are one of the most popular transplants or the highest done transplants all across the country, and the science of kidney transplant has been developing. The technology has been developing since years. So, what makes kidneys more easy to transplant as compared to other organs such as heart or liver, and how can we see the success rate being higher in kidneys? Can you please elaborate a little bit on the process?
Yes. So you have rightly said that over time we have evolved about solid organ transplants in general, in which kidney, liver, heart, lung, and pancreas and intestines and a lot of other types of transplant that can be done. Over time, both medical side and both surgical side has become evolved over the decades. From the medical angle, I can tell you the drugs that we use for transplant, the kind of immunosuppression that we have been using, what was used in 1960s to what got evolved into 1990s and 2000, and now what we are using has tremendously evolved. And these are very effective drugs which blocks a certain pathway of your immunity so that your kidney don't get rejected. So the number initially when we started, it was only 40-50%, and then gradually now we have gone above 90-95% transplants are getting successful without any major rejections, and it is evolving even more. So that is the medical angle which has become better. The kidney transplants have become easier and widespread as compared to heart, lung, and other things is because of two major issues. One is the surgical side has evolved also tremendously. The surgeons, more and more surgeons are getting trained. They are using laparoscopic surgeries. They are using robotic surgeries nowadays. So the donor morbidity, especially in the live related ones, the donor morbidity is very, very less these days. Even in our setup, we discharge very soon. Most of our 99.9% of our donors are having no issues absolutely post transplant. So the donor morbidity has gone almost next to zero. So that is also one reason why kidney transplants have become very widespread. Surgeons have become trained. So that's why the kidney transplant is little comparatively easier as compared to heart and liver.
Thank you so much, sir. So, while we were discussing the eligibility for donating and receiving a kidney, you mentioned about the donor, eligibility for being a donor. So, there are two types you mentioned, that is live related donor and cadaveric donor. So with related, you mentioned that the person should not be suffering from all these different diseases. Would obesity and simple diseases, lifestyle diseases such as diabetes, would also come or make somebody a non eligible donor? Or are there stages if somebody has diabetes, so the stages of diabetes needs to be checked, that if it is a controlled diabetes, then the person would be able to donate kidney or not? How does that go?
So I believe the question is regarding the donor, in which what makes the donor eligible or not, and especially the two diseases you have mentioned about diabetes and obesity. Now, this is a very ongoing, burning debate about who can donate. And the second thing is about there is a major issue you have to understand: the demand for a kidney and what is being supplied. There's a huge mismatch right now. So the idea is to make aware everyone, like this meeting, and many more meetings like this have been happening. The government bodies, the state bodies, all are trying to make people aware so that the donor pool is more. The other side of the donor pool is we are trying to take people who are marginally unfit. For example, diabetes and obesity. Now, there have been guidelines up by the national and international bodies in which they have clearly said that diabetes uh, is a risk factor and obesity is a risk factor. And if we take from these people, these are marginal donors. Now, can you take all diabetics? So, no. If somebody has got an end organ damage secondary to diabetes, and if they are on insulin, uncontrolled sugars, you cannot take them. Second is, if somebody is having obesity more than a particular value. For example, in our setup, we have chosen a value of 35 BMI. In other setups, there have been 30. The guidelines are also very depending on what the European bodies are saying, what the North American bodies are saying. But guidelines are different. In our setup, we have chosen 35. Now, the number of 35 is the value that you choose in your setup depends on how the surgeon is comfortable, how we have counseled the donor, and how the physicians are comfortable. So it is more of a surgeon's difficulty, because very obese people to take out the kidney without having much of morbidity to the donor is a very surgically uphill task. So 35 is something which we have chosen a value. It varies with the transplant program. Most of the bodies are up to 35. So that we can take.
Thank you so much, sir, for elaborating that. Also, the another segment was taking kidneys from cadavers, that is cadaveric donations. So, in India, is there any laws or rules that allow the medical body to extract organs from those deceased in road traffic accidents like that in foreign countries, or do we need to take permissions from their relatives? Thereby, the process and the timeline gets delayed. And how does that go?
So in India, the overall transplant programs are all registered under something called as National Organ Transplant Organization, the NOTO, and then there are state and SOTO and ROTO, the state and the regional ones. The guidelines are very clear, but at the end of the day, the question that you have asked is, somebody has died on the road, can you take organ without, so in most of the there are countries in which they are all are going to donate except you say no, and in India it is not like that. All are not. If you say yes, then we will take. Otherwise, we are not going to take it. So the law is little different. I mean, you have to donate unless you tell a reason, or for some reason you are not donating. The family can say no. In India, it's the other way around. If they are convinced, then only we will take. Otherwise, not. So the convincing part is very, very challenging for transplant coordinators as well as for doctors. It's not that easy. Laws are there, but they have to be more modified and more transparent, so that there are no problems happening on both sides. If you make it so liberal, there can be challenges on the people who are you're not supposed to take, you will take from them. So that's a very brief gray zone and very thin line there, so that nobody is harmed, and all the recipients who are waiting in the transplant list gets their organ. So in India, the laws are there, but they have to be modified, and more political will has to come out, because it becomes a more of a social and ethical reason than just medical reason there.
Definitely, sir, very rightly portrayed that the awareness around this is definitely low. That is why, and that is why most of the people do not are not willing to give any organ donations of their relatives after they have deceased, as compared to other countries in which laws allow the medical bodies to take organs from after road traffic accidents, which it is not so in India. And do you believe turning this law otherwise, like that of developed nations, would help us in reduce the gap between the demand and supply to some extent? What are your
Yeah,
thoughts?
definitely. It will, we will start meeting the demand. But the problem is, the like I said before, social and ethical reasons. Plus, you have to have proper laws and authorities who will overlook these programs. Because if you make the other side down, that only the doctors or maybe the hospitals or other places are by themselves will start taking organs without many permissions, then that also can be abused, especially from the patient's perspective. Being a doctor perspective, we know that we do most of that, we do ethical work, but many a times it has the patients and the general people who are getting affected should be convinced that the doctors, the authorities are doing the right thing, because their relatives and their parents, their brothers and sisters are getting affected. If they had a head injury and we are taking their organs, they have to be mentally clear that yes, it was a head injury which after which will not recover, and we are not in a hurry to take their organs without being very very sure that they will not recover. And that's a very very gray zone and a very thin line, where it can become a big social and ethical issues. Laws can come in place, and it's very very difficult for people to convince their loved ones are dying, and at the other end you are telling them we're going to take their organs, and in that grief state of mind it's very difficult to overcome their fears and doubts.
Definitely, sir, very rightly pointed out that this topic of donating organs depend on the time after death, because organs are time sensitive. You can extract organs only in limited periods of time, and then when the family is grieving, convincing them is another mindset. Conditioning that needs to take place, as well as India being a very multi-religious, secular, and multicultural country where all different cultures come together. There, religious aspects also come into play. So I believe for the long term, a great deal of effort is required in motivating people, or just inculcating this root thought, that is, you would be helping so many lives if you choose, if you are willing to donate organs after death. And this thought needs to be deep inculcated into the society for many years, for us to come closer to reducing the demand and supply gap that we are facing around all different organs in India. So let us move on to the different aspect on the recipient side and talk a little more in detail what all different conditions make a person good recipient to have donated kidney, or in which diseases is a kidney transplant recommended.
In Can you please repeat the question? There was some blurring
Yes,
there.
sir.
Sorry.
So we want to know now that when it comes to the recipient, of kidney transplants, what all different medical conditions makes a person a good recipient, and when is the kidney, transplant recommended to somebody?
I think we have answered this question before. Stage 5 kidney disease and people who are on dialysis are eligible for kidney transplant. Uh, there are some age cutoffs as well. People above 65, 70, 75 in different guidelines have said this. But in general, what we need to understand is people who are elderly, if they are otherwise fit, if they are otherwise okay, their heart, their other organs are absolutely okay, their mobility is fine, they're otherwise living a healthy life, they should be the ideal candidate for transplant. Age particular bar like 60, 65, 70 is not a gray, black and white. So it is a, when you go above 65, it becomes a little gray zone. Depends on how fit the recipient is. Now in the if you go to the pediatric side, when the there are young people, neonates whose kidneys are not working. So we have to, before we start transplanting such young people as well, there is a weight based guideline here in which they have to be above a certain weight so that they're able to take the kidney, the surgical stress, and the adult kidney which is being donated to them, they're able to take that kidney inside their body and start functioning. So above a weight of, let's say, 10 kgs or 20 kgs, depending on the program that you're working and your surgeons are comfortable. So that is the cutoff. That is the extreme. The age in neonatal side or the infantile side or on the elderly side. Major organ should not be damaged, whichever age group you are choosing. So you should not be psychiatric, should not be a psychiatric patient. You should not be some sort of addiction should not be there, or other organs have to be fit. Otherwise, you have to transplant that organ as well. For example, liver or heart or other things.
Got it, understood. My next question I will take in Hindi because this ये बहुत ही कॉमन मिसकंसेप्शन है जो लोगों के मन में होता है कि आपने जैसे बताया कि अगर इंसान फिट है, अच्छी एज का है, पर ऑल अदर ऑर्गन्स आर फिट, उसके बाकी सारे ऑर्गन सही हैं, एंड ही इज रिकमेंडेड एंड हैज स्टेज 4 kidney disease and is recommended to get a transplant. So many people feel that why हमें क्यों ट्रांसप्लांट करवाना है जब हम डायलिसिस से भी करवा सकते हैं. तो दे कम टू देयर डॉक्टर एंड ट्राई टू नेगोशिएट विद द डॉक्टर कि जरूरी है क्या सर ट्रांसप्लांट करवाना. And it is been said by many doctors that if the person is able to take the surgical stress, it is better. Kidney transplant is far more better than dialysis, long-term dialysis. So, sir,
Okay.
can you please, help us understand this entire scenario, why this is better, and also thereby motivating all the viewers who are hesitant to go for transplant or are thinking otherwise to, give a clear picture as to why.
इसको मैं थोड़ा सा एलैबोरेटली आंसर करना पड़ेगा, क्योंकि बहुत सारे लोगों के मन में डाउट होता है कि हमारे बहुत सारे रिलेटिव्स हैं जो डायलिसिस पे हैं और 5 7 साल 10 साल से चल रहे हैं, और हमारे कुछ फ्रेंड्स हैं जिनका हमने देखा कि ट्रांसप्लांट हुआ और 6 महीने साल में वो खराब हो गया, और उसके बाद उनको बहुत परेशानियां हुई,
Exactly.
पैसा भी उनका लग गया, उनका डोनर भी खराब हो गया, और वो अच्छे से नहीं चल रहे हैं. तो सी यू कैन यू हैव इट इज ऑल अबाउट स्टैटिस्टिक्स. यू कैन नॉट चूज वन पर्सन and generalize it for the whole society, both for dialysis and transplant. Dialysis have also modified over the last decades, and I would definitely say it has become better and better and better. People are having good lives and they're living longer on dialysis. But if you see the transplant scenario, you cannot compare dialysis with transplant. Dialysis, there are too many issues. First is you have to be at the center, or even if you're choosing home hemodialysis, you have to dedicate that particular time. It is sometimes not cost friendly as well. And post dialysis, there are many issues. There are so many of my patients who are on dialysis and are very positively motivated, but still many times after dialysis they are feeling a little weak, they are itching, the appetite is not good. Sometimes there is hypotension during dialysis and a lot of other issues. They are not very confident whether they'll be able to join duties, or they will be go back to their normal life. But on the other side, if you do transplant, after the initial 3 months, or in some programs 6 weeks of rest at home and proper precautions, you can go out and go back to your normal life, go back to your jobs and start driving a car and other things, so that you can get back to your normal life. So transplant, you just have to take some pills, be on regular follow with a doctor, and you are back to your normal life as you were before. Dialysis, on the other hand, is not so. So you cannot compare. If you take the mortality and morbidity data also of dialysis and transplant, in which people have, how many survive after 5 years, how many survive after 10 years, what are the quality of life that people are having during dialysis and transplant, are also poles apart. There is absolutely, you cannot compare them. The quality of life is far superior, the survival is far superior, so you cannot compare. But on the other side, the patients are, it is a democratic country, the patients are free to choose the type that they want. So we have, it's as a doctor, as a service provider, it's my job to tell them all the opportunities, the pros and cons of all the options available. But the patient becomes the last person who decides what they want to choose, the kind of life they want to lead. Because many a times in India the laws are very very strict, and rightly so. that you can take it from your close ones as well. So if you take the elderly people whose kidneys are damaged, like 60s, 70s, and in that range, most of these people don't want to, take it from their younger sons and in-laws, or younger people. They don't want to take it from them, part because of the love towards them. We have lived our lives, and you are just starting your way out, so they don't want to take it from them. But so though you have to consider the patient's options as well. Give them the right choices, tell them the pros and cons of it. But the all said and done, patient is the last person, has the last call, what they want to choose.
Definitely, sir. Very rightly pointed out. You explained us all the thoughts and feelings that go behind the patients and families' minds while choosing, this or that treatment, which is a very real scenario, and people face these sort of, thoughts at every stage. And we would like to encourage all the viewers that are watching that if you are in such sort of dilemma, please do not hesitate. Reach out to your medical practitioner, your specialist, and talk freely to them, discuss all the options. I am sure they will be able to help you out in all different aspects, clear all your queries and thoughts. Let us now move on to the another big question query that people have all the time since this organ donation thing has started, is matching and compatibility. So how do you analyze if the match is suitable between a donor and a recipient? On what specific factors that compatibility it is influenced? So can you please help us understand?
The first matching that goes through everybody's mind is about the blood group compatibility. So the blood group compatibility is one aspect of it. So before 2008, 9, 10 in India, we were not doing incompatible transplants, but in the last decade or so, almost all transplant centers are doing it. The what you can say, the all transplants have become suitable for these, and the approaches towards the ABO incompatible transplant also has become easy. And the kind of protocols that are there shared by the Indian guidelines, we have our Indian guidelines, plus we have our international guidelines, plus the almost a decade of data which is suggesting that ABO incompatible transplants are also almost as much successful as the normal transplant. So that is the first barrier, which today's scenario, it is not the barrier anymore. There is a little extra financial stress on the patient side, because when to match these incompatible groups, there are certain steps that we need to take, but it can be done. So it is not a barrier anymore, except a little bit of finances. Second aspect of it, the normal cross match and cross matching. Now, the kind of cross matches that we are doing in the last decade or so have become really evolved. Especially the flow cytometries have become very, very evolved. They've become very, very sensitive to all kinds of antibodies, whether they are HLA based antibody, whether they are non HLA based, whether they are complement binding, whether they're non complement binding. So the patients don't have to understand these kind of details about their matching, but they have to understand that this, like everything in the world, this has also evolved too much. We are getting better and better at cross matching. Most of our centers are doing a phenomenal work in which these cross matching types, especially the flow. Initially, we used to do there were many issues. Now we are doing it in a very sophisticated manner. So cross matching has become very, very evolved. Second, the thing that you need to understand is about the using of the DSAs. Now, what is DSA? Is a donor specific antibody. So this is more relevant, especially in the living donor program, like most of our centers in our country. So the person who is having kidney problems as a recipient might be sensitive to a lot of people. For example, they had blood transfusions is very common during dialysis. They might have had a previous transplant who is failed, or there might be having multiple in female patients. They might be having multiple pregnancies, multiple other types of surgeries. The vintage of dialysis is very long. All of this causes a lot of sensitization in their body, and they have a lot of antibodies to the general public. So the so-called PRA that is there, panel reactive antibody. They might be having a lot of antibodies, but the person who is donating, they might not be having enough antibodies or almost no antibodies towards that person, and that is what is called as donor specific antibody. In a easier language, you might be having a fight with everyone, but the person you're going to get married with, you have no fight. So So that is the meaning of donor specific antibody. Your particular donor you have no issues with. So you have to see your donor specific antibodies and see how whether they are really there. And even if they are there are certain ways and methods to remove those antibodies. And recently in our setup as well, we have done second transplants in my center. We have done transplant in which there were high antibodies were there. We have done ABO incompatible transplant in which the antibodies were not matching. And there was a recent paper also which was released by the Indian group of stalwarts of nephrology, that we can go up to almost 1:1,000 titer of ABO incompatible easily. So all my listeners today, please feel free. Our transplant programs have become really, really evolved. You can go ahead with your transplant in spite of so many barriers. Uh, there are still issues and challenges, but I think we should be able to cross them soon.
Thank you so much, sir, for sharing everything. It is so fascinating hearing all the advancements that have been made in this science of kidney transplants, this area. So, another query that people really are concerned is post transplant care. And they feel that after transplant, even the donor and the recipient, both health would be affected to far greater extent. And that is why they are hesitant to go forward with this sort of decision. So can you please explain us the post-transplant care that should be there, and any potential risk or complications for both that might be there, or please enlighten.
From the donor side, I would say pre-transplant we do a lot of testing, a battery of tests from head to toe, and only when they are fit enough they are taken. And even if they are marginal donor, they are informed about all the potential problems. So most of our donors do very, very well, and they have been told about regular checkups, regular blood and urine testing, and regular follow-up with our transplant team so that they don't get any issues. So donors are very well taken care of. They are always and always at our setup, and I'm sure across India they are seen free of charge. In Hindi we say Angdan is a Mahadan, and they are honored across the country that if you have donated an organ, you get a massive respect, and from the medical community as well as from the general public as well. And getting a little one step ahead on this, I would urge the national bodies as well as to our lawmakers. They People are trying in the other Western countries as well. These donors should get more benefits based on their. They should get health checkups. Should be free for them. Some sort of financial benefits, and maybe in jobs, maybe during travels, maybe during their studies. Their whatever step of the way, life of the way they are trying to opt for. They should get a little priority because they have donated their organ. If we do this kind of thing, more and more people will get encouraged to get this thing done. So that is something we should really, really do. Especially, they should get a medical insurance, because once they have donated their kidneys, even though we have done a battery of tests, human body is extremely complicated. You never know what is going to happen 6 months, 1 year, 2 years down the line. If they get free of cost medical insurance for life, maybe through a lot of government schemes that are going through, that lawmakers would know better, they'll be far more reassuring for them that if I donate, the doctors, the government bodies are with me. If something goes wrong, they will take care. This is an assurance which if a donor gets, they will freely donate without any medical hassles. So that is something which I would like to highlight. Second thing, as a recipient, there are so many things that you need to take care post transplant as well. So the first and foremost, I would like to say this: there are many things post transplant which are there in your hand. Second thing, which is not in your hand, the rejection aspect of it, and the other kinds of it. If you are taking regular pills and if you are following proper medical advice, rejection is something you should not be worried about. That's a doctor's headache. Please forget about it. What you can do is the keep yourself free from infection. And I counsel all my patients about cannot undermine the habits that we got during COVID is wearing mask. I always counsel to all my patients, like the moment you go out of house, you wear your t-shirt, you wear your pants, you wear your attire. Please make mask a part of your attire. The moment you go out, if you're a recipient, not for the donors, for the recipient, if you're a recipient, please make mask a part of your attire, so that whenever you go out, you have the habit of using it. Second is about the clean water and clean food. and this is to be highlighted to the core. People feel that whenever we go outside, even in bigger hotels and restaurants who are fancy restaurants, and we feel the food is clean enough. Many a times, there's nothing to no nothing against the bigger restaurants and hotels, but many a times this might not be the case. So it is better not to opt for especially dishes which can be sour, or which can be made in the morning and being served to you in the night, and you have to choose your what you eat outside very very carefully, so that you are 100% sure that they are made fresh. So that's one aspect. Second is, especially in the first year of post transplant, I would say it is better to avoid eating outside, and try to go through your first year without any infections. The body gets very very used to, most of your immunosuppression is very down to a very low value after the first year of transplant. So in the first year of transplant, if you take utmost care, the chances of you taking your organ to more than decades are much higher. So these are the precautions that you should take. Regularity of the pills, the timing of the pills are very 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 important. So we do a recorded medical meeting at our setup, and it is being a mandate from the noto. So we are doing it, and they are counseled every time. So these are the precautions: infections and rejections, regular taking of pills, and not forgetting to take a pill, doing regular testing, and following up with your doctor. These are very 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 important things. Even if you have no issues, you're doing very very well, so that you continue to do very well, please follow up.
Thank you so much, Dr. Bhanu Mishra. It was such a delight talking to you and hearing all the different wealth of knowledge and information that you imparted us. I wish we had more time at our disposal. We could go on and on with ends of queries, but as we are short on time, let me ask you your takeaway message for all the viewers that are watching.
Before I give you a end message, there is one topic which we did not go into a little detail, and I will take a minute to highlight that, and that is the part of the cadaveric donor. And one is after the brain death. The head injuries have happened, younger people mostly. That is one aspect that we have talked a little bit, and most of the people are aware of that. Second is about the cardiac stem cell transplant. Now, this is something which in India is not practiced in depth. There are certain stalwarts in this kind of surgery. This is both medical, surgical, and the hospital administration wise, the policy maker wise. This has to be highlighted, because, and just to give you in a plain simple language, people who come to our emergency for, let's say, not a head injury case, and for some other problems, they have got, they have lost their lives in emergency for whatever medical reason. Once we have tried to resuscitate them, we have tried to bring them back to us, but let's say we fail in that, and it is not an uncommon scenario. That is also a time where we can counsel the members, that family, that their loved ones can donate and save 8, 10, 12 more lives. I understand this in brain dead also. It is a very challenging scenario to counsel their loved ones, please donate. In such a scenario in which they are in so much hassle, they are in so much stress that something has gone to wrong with their loved ones in the emergency, and somebody is telling them to donate organs. A lot of wrong feelings also come into the relative's mind. But this has to be organized, and every step of this is already being documented. It is not rocket science; it can be done. But surgeons, physicians, the hospital bodies, and especially the social bodies, NGOs, and our lawmakers, our politicians have to be with us on this, and validate this even more and more and more, so that when it is validated by the society, by the lawmakers, the politicians, the hospital bodies, you get reassurance that nothing is going wrong being done with you. So this is something that needs to be highlighted, that this is also a type of organ transplant that can be done. At our setup, we are trying to get it done with the help of my HOD, and we are trying to set up something like this. But it is a very, very uphill task in our society, in nephrology society in India. In SGPGI Lucknow, there was a series of lecture done before. Something also is being already done in Gujarat. So we are trying to follow their models and trying to get things done in coherence with the local authorities. So this is also something which needs to be highlighted. Please, all the listeners, if you are a patient, please ask your doctors whether they are trying to get this thing done. If you have connections, please ask your authorities whether why this is not available in our society and work towards it. Thank you very much.
Definitely, sir. Very important point you pointed out, and definitely there is a whole lot of shift in mindset that is required in the entire society, so that the families of the patients do not feel otherwise when the doctor is counseling them for, as you said, cadaveric standstill transplant. Yes. As we come down to the very end of this discussion, your thoughts, your takeaway message to all the viewers that are watching.
My takeaway is simple. Transplant is the way ahead for all the patients who have stage 5 and people who are on dialysis. If you're otherwise fit, you should be the fit candidate for transplant. We should move more and more towards the cadaveric side and not the live living donor side, which is the case currently. And it is an uphill task moving towards cadaveric side, but awareness programs like this and many more should be conducted at all the nooks and corners, and all your societies and your public health policy should be made in that way so that more and more cadaveric transplants can be done. But one simple liner would be transplant is the way ahead. Please contact your doctors, know about transplant, know the pros and cons about transplant, and you should be the eligible candidate if you're otherwise a fit person. Thank you.
Thank you so much. With that, we wrap up this very interesting session with Dr. Bhanu Mishra, Associate Consultant Nephrologist with BLK Max Hospital, New Delhi. Thank you, sir, so much for taking out time from your busy schedule, imparting us with wealth of knowledge today. I hope the session was just as enlightening for all the viewers as it was for us. Thank you. We would also like to thank our partner, JB Chemicals and Pharmaceuticals, for this brilliant initiative on making imparting awareness around kidney care. Thank you. And I would also like to thank all our viewers for staying with us till the end. With that, we sign off now. Stay happy, stay healthy. Thank you. Bye-bye.
Thank you.